should women who are pregnant be taking supplements?
Most definitely. The supplement that they should be taking pre-pregnancy, pre-conception, they should be on folic acid. Folic acid is cheap, it's easily available, and anybody who's planning a pregnancy or thinking of falling pregnant should be taking folic acid. The remainder of the supplements really can take place a little later in the pregnancy, from about 15 weeks, things like iron and calcium, but most importantly pre-pregnancy, because it's been shown that those patients who supplement with folic acid have a lower risk of spina bifida, which is a spinal cord malformation, which is just so easily preventable.
All right, now, what is your recommendation on what should pregnant women be eating? Should they just be eating healthy, balanced diet and making sure to take the supplements that you've just mentioned?
I think there's a lot to take into account there. It's not just about what you're eating. You want to have a healthy lifestyle. So no alcohol, absolutely no alcohol during the pregnancy, no smoking, and then looking at making sure you're covering all your food groups. So you've got your fruits and your vegetables, your carbohydrates, your proteins, all in a fair proportion, and drinking lots of water.
It's interesting you mentioned no alcohol, because you'd often hear some pregnant women saying their doctors say it's okay if they have a glass of wine with dinner or a glass of wine here and there. What's your take on that?
There are no safe studies to suggest that any alcohol during pregnancy is advisable. And it's a short period. It's 9 months. One can do without it. It's a good time to be without alcohol. Why do you want to put extra strain on your body when it's already under having other demands placed upon it?
Nikki, besides eating healthy, which we've talked about, and leading a healthy lifestyle, is there anything that women who are pregnant can do to make their pregnancy easier for them?
Make sure you rest. I think that's also important. Take the time to rest and let your body adjust. Manage your stress, manage your lifestyle. Exercise is such a valuable tool to manage your lifestyle and your stresses and your weight. So adequate amount of exercise. Hydrotherapy is fabulous because it's not weight bearing. And there are people who are trained in those sorts of things, or even those baby exercises, those Pilates classes that are offered for the pregnant moms. And it doesn't have to be a class. Even if you can't afford that sort of thing, if you just make sure you take a brisk walk every day for 30 minutes and that you are more active.
And I just want to know, before I let you go, how often would you recommend a pregnant woman to see her general practitioner throughout the pregnancy?
Well, a patient really ideally, in the ideal setting, should be managed by a specialist during the pregnancy, because they've got many more of the tools handy to monitor those patients. They've got the ultrasound facilities, and there's a risk associated with managing a patient. So the role of a general practitioner for the patient during the pregnancy is really a supportive one of the specialist. So anything that the specialist isn't able to cover, if the patient, for instance, has a cold or a flu and wants advice on what they can and can't do while if they're sick during the pregnancy, or if there's an emergency and they cannot get to see their specialist, that's where the GP would play a role. Ideally, the patient should be seeing their obstetrician, and their obstetrician would make appointments based on where they're at. So towards the end of the pregnancy, the appointments become more frequent.
Now, a question just came up for me there when you were speaking about cold and flu. Should women who are pregnant avoid taking medication for things like cold and flu, or headache tablets for that matter?
Absolutely. There are things to avoid. There are medicines that are absolutely contraindicated during pregnancy. So even over-the-counter cold and flu remedies, one should be asking the pharmacist or even your own GP if it's safe to take. You wouldn't want to be taking anti-inflammatories during a pregnancy. You would try not to take any of the very sedating analgesics. Paracetamol is considered relatively safe, although there are no ethical studies suggesting its true safety, but we know anecdotally that it's safe in the patients that have needed to use paracetamol. Vitamin C is perfectly fine, but anti-inflammatories and amphetamines or pseudoephedrine, which is very common in the cold and flu medicines, should best be avoided.